Hi guys, it's Loukisha from Loukisha Story, and hi, I'm taping from a new space. I know, crazy, right? Ryan is sleeping, and he has a tendency to be very vocal with sleeping or snoring, and I didn't think you guys wanted to hear that while I was taping, so I just moved to the couch and I'm taping here. So new kind of whole, different feel, I guess, in me and my couch. But today I want to just kind of do a little bit of like a things of just some stuff that's on my mind. This would definitely fit under coffee, tea, and chats with me, but I don't have any tea right now, so we'll still put it under there. Lately, I have been getting a lot of questions and some, private messages and stuff asking specific questions. One of them is people running into medical personnel kind of totally putting away, talking negatively and saying that there's no such thing as HAE Type 3, HAE Normal C1. We have so many names and it's just going to keep morphing. And they will actually say that there's no such thing as a Type 3. Some will say, yes, there is, but there are no medications that will work or help you of the current HAE therapies that are out there. My goodness, and the list goes on and on. And so I wanted to address that. And so here it is. The individuals that are telling you this are utterly, completely mistaken. They are very ignorant to the information that is out there. I know we have different medical personnel who have different opinions or things. However, one thing is for sure. There is a classification. It is called HAE with Normal C1 or Type 3. We do not have diagnostic testing, so you can't take a blood test and find it. However, they are working on those things, and the way that you can find out if you do have it is they give you medications that they would give to someone who has HAE Type 1 or 2. And if that medication works in resolving your swells, then you are part of the HAE family. Whew. I cannot tell you how many messages, phone calls, emails, in person that I've talked to people and they are in tears and they are absolutely broken because someone told them there is no such thing as HAE Type 3 or Normal C1, and that there are no meds to help you and you are very much on your own and forget about it. And that is the furthest thing from the truth. There are some entities, individuals, and other stuff that will try to say differently. I'm not going to, name names. I'm not going to pull anybody through or whatever, because that's not who I am. But I will tell you that there are individuals out there and they will say contrary to that, and they are absolutely wrong. There have been some people within the last 10 years who have felt one way about it and have completely changed as years have gone on and as they've done more research, more reading, treating more people, and they have actually had to kind of go back and kind of backtrack on what they said and issue apologies and just kind of go from there. There is a lot of documentation out there of people who have information showing and stating that these specific therapies work. I use 2 of them. They work well for me. I have used a lot of them in the past, different ones. I think there's 7, and I think before some of the other ones came onto things, let's say 1, 2, 3, 4 or 5 of them I've used. And just like any type, whether you're Type 1, 2, Normal C1, 3, HAE, PLG, which is another thing I'll get into at another time. It doesn't matter. We all have to find a medication that works for us. And so that's trial and error. So you may have to go through 3 or 4. Sometimes there's a combo that may work better than others. Sometimes dosing may have to do with it. But whatever it is, we all have different bodies. HAE will present differently in everyone's bodies, and everybody will respond differently to the different therapies that are made available to us. But the point is this: it's not a one-size-fits-all, and that is for any disease, and that is for any treatments, medical treatments, even the way that sometimes a person's body will, present a flu or a cold. It looks different. It may do this for one person. It does this for another one. If you have diabetes, it presents a certain way. Everybody. So there isn't a one size fits all. So if we are able to do that when it comes to any other disease, I find it I can't get my head around it. Why, for some reason, all of a sudden, when we get into rare diseases, and the medication doesn't work a specific way or do it in a certain way that everybody hopes it will, then all of a sudden we're X'd out and we're told, well, you don't have that disease then, and it's not working for you. Or you're taking a medication and there's times it works like awesome. And then you just get like a month or so and your body's kind of doing some strange things. So the med isn't working the way that it used to. And so maybe you have to dose more frequently. Maybe you have to increase the amount for that month. That doesn't mean that you don't have that disease and take away your med from you. I cannot even share how many times of people having their meds taken away from them. Years ago, I was in the hospital and there was a doctor who had seen me years prior, and I was on a vent for 2 weeks and just all of that stuff. And I didn't have the diagnosis of HAE. So years later, I'm back at the hospital again because I was having a flare, and the meds just weren't working in the way they needed to. I was dosing and it was reducing the swell. Then after so many hours, the next day, I'd have another swell that was just as bad or nastier than the other one. And so he basically kind of went in and saying, I don't think you have this disease. I think your specialist is kind of off the mark, and he's not really as, very well versed and educated in this. And I want to basically take away your meds, cause you to have an attack or wait for an HAE, for a swelling attack to happen. And then I'll give you some, an antihistamine. Really? Because that antihistamine is going to solve it. I said, if you can take an over-the-counter antihistamine and give it to me during an airway, tongue, face swell, and it fixes it, not only will I, but there are other people who will chant your name, have a ticker tape parade, throw confetti in the air. We will have flamethrower, fire eaters and all kinds of stuff, whatever it is, contortionists, you name it, to come and to celebrate you. We will name a holiday. You'll have a name for a day. Hell, the way that we've gone, the stuff we've gone through, we'll give you a month if you want. That's just dedicated to you. However, that is not the case. And for me, if I wasn't educated, and if I wasn't a person knowing the rights that I have as a patient and as a human being on the planet, I would have allowed him to strip me of my meds and see if we can try all these other foolish ways of trying to deal with a swell, an airway swell and a face swell, which we know that won't work. My body will not respond. It's not, you can't treat me as if I'm an anaphylaxis or having an anaphylactic shock, which is basically an allergic reaction to something. I am allergic to bees and wasps and yellow jackets and other things. So I know the difference between an allergic reaction and what that feels like and how it presents in my body, as opposed to an HAE attack, which will affect and have swells in my face and my lip and my throat and stuff. When I am having an HAE swell, those meds will not work. Anyone who has HAE, you cannot do your regular regimen of an antihistamine, a steroid, and epinephrine. It will not work on an HAE attack. That's your first indication that you're dealing with something else that's not histamine mediated. That means your histamines in your body are not pushing along the attack that's going on in your body. For HAE, some will also call it, especially when we start dealing with type 3s, we'll call it bradykinin mediated, which is basically a really fancy word of saying that that particular substance of the bradykinin that's in your body it is pushing or causing a swell. And I'm going like really like elementary and not really going into a lot of it, because if I do, your mind just starts to hurt. But nonetheless, anything that you use, if you're having an allergic reaction, it will not work on an HAE swell. So if it wasn't for me knowing that, I would have let that man strip me of my meds. Now, I put my hand over my IV. I looked at him and I said, "Get out, please, and thank you." And he's like, "Well, wait. I said, "No, you treated me 2 years or so ago. You probably don't even realize it. I was on a ventilator for 2 weeks. And you basically told my family to come in and to say their goodbyes because I was going to die. So, am I going to listen and follow your advice and your regimen, or am I going to do it with my well-known, world-renowned HAE specialist?" I think I'm going with the specialist. And so I said, "Please get out." And my nurse had her mouth covered and her head turned. She was trying not to bust up laughing. And he's like, "No, you can't." I said, "Yes, I can. Get out. You're fired. I don't want you anymore. Please and thank you. Leave. Don't touch me. Don't look at me. Nothing. I don't want you treating me anymore." And you have a right to do that. And a lot of people don't know that. You have a right to tell, there's a doctor, you have a right to tell them, "I no longer want you to treat me." If you have a nurse that is being really oh so special, you have a right to tell that nurse, "No, thank you." And that they need to go. And you can talk to a charge nurse. You can report them to patient relations at whatever hospital that you're at. And there's oh so much more. And I'll go into another video that's very specific about that, because I've been getting that stuff too. And it just makes me madder than a wet hen. So as you can see, I am just a little ticked off, and this is like a... And so I'm trying to just relax, relate, release. But nonetheless, you do not have to submit to that kind of treatment. Do not let them take away your meds from you. If there is a doctor and if they are not playing like a team player and they are not on your side, get rid of them and find someone who wants to be a team player. You deserve to have that treatment. You do not deserve to be said you're a hypochondriac, that you're crazy, that you are a drug seeker, that you are, manipulative, that you are an attention seeker. Those are none of those things. Anyone who has ever endured an HAE swell, there's no way you can fake that stuff, and there's no way that you want it. You don't want to have it. I mean, I've had people try to tell me that it was psychological. It was psychosomatic. So it's something that's going on, unresolved childhood pain or whatever. And I had a psychiatrist and a psychologist say, there's nothing in the world that I could do to make my tongue swell to where it's outside of my mouth and my face to twist and contort by thoughts. No matter how upset I got. I mean, normally if you make you're upset, you can throw up, you can hyperventilate, you're breathing, whatever. But to have my tongue to swell where it's hanging out of my mouth, my face to twist and contort, and my eyes to be so swollen that they're shut, there's nothing I can do in here in my mind to make that happen. If I can, I want to show y'all. I want a Vegas show. I want dancers. I want confetti. I want lasers and everything. I want a big, and put it and take me to Vegas. And I tell you, I will have the best show on Vegas Strip ever. However, that's not the case. So to tell us that we're crazy, it's in our heads, and we need to go see a psychiatrist or a psychologist is just absolutely insane, and it's wrong. So hear me, my swell family. Please hear me. You have the right to get the treatment that you deserve. Do not let someone take away your meds from you, and do not stay with the doctor who is belittling, attacking, and making you feel about this small when you leave their presence. They're not listening to you. They don't want to seem to believe you, and they just think because they have these letters behind their name or in front of their name that they are the expert and you have to listen to them. You are an expert on HAE that's in your body. You are an expert for HAE inside of you. You know what it is. You know what works and what doesn't work. Don't back down on that. You don't have to rant, rave, kicking, screaming, and cussing. I don't do that. That's not who I am. But I'm very direct and I am very assertive and letting them know that what they're saying or doing is not right. It makes you feel uncomfortable and that they need to move on to something else. So I implore you, this is the reason why community is so, so vital, of having connections with people who have the disease that you have, and to connect with them so that you get the encouragement, the love, and the support that you need to be able to get the treatments that you so rightly deserve. And so I'm going to stop this for now because I could keep going. There's some other ones and other things that I will talk about in another, video, but I just had to get that out tonight because of some of the things that I've read and some of the conversations I've had within the last few days. And so, please, 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 please educate yourself. Knowledge is power. The more that you know and the more that you're educated about your disease, the better that you can do in finding the right medicines, doctors, immunologist, allergist, whoever it is that wants to treat your HAE. You can find the best one possible because it's a team effort. So till next time, thank you so much for listening. If you have other things that you want me to talk about and share, put them in the description box below. Or in the comment box below. If they have a suggestion for something else, put it there also in the comment section below, and I will happily get to it. Until next time, remember, everybody has a story to tell, and don't be afraid to tell yours. See you guys next time. Love you much. Toodles. Bye.